Hi, Prof. Shabir.
Hi, Mercy. How are you keeping?
I'm good. How are you?
Good, good. Thank you. Um, let's hope we get some reasonable attendance. Hi, Jamie.
Yes, we tried to share it on all our platforms. So hopefully we will get a good number. And because it's a weekend, students won't be in school. So hopefully they'll join.
Yeah. I have to leave, so I'll leave you all with the meeting. Is that all right?
That's all right, Prof. Shabir. Thank you.
Yeah.
Have a nice weekend.
Thank you. You too. Bye-bye now.
Bye. Hi, Jamie. How are you?
Hi, Mercy. Good, thanks to you.
Same here. Hi, Almudira. How are you? Thank you for joining us.
How are you, Mercy?
I'm fine, thank you.
I'm very glad to join you.
We're also glad you're here. Let's just give it a few more minutes and see how many more people will join.
Okay.
Also, Jamie, we'll just do it the way we usually do it. The only difference today will be Marie Claire will make a presentation on the Youth Hub.
Okay, perfect. Thank you.
Yeah. And then probably later we'll have to get together and organize the mentorship workshops. But for today, we'll just mention that they should look out for them and we will give them more information in the coming weeks.
Okay, perfect.
Hi, Marie Claire. How are you?
Hi, I'm well.
Thanks
How
for
are you?
joining. We're just
No.
waiting. We're hoping people will join. I am
Uh-huh.
doing another round of reminders in all the groups that I know have young people.
Okay.
Hopefully, people will join.
Okay. No problem.
But sometimes I realize people have a problem with time zones.
True.
Mm. How much longer do you think we should wait before we start?
Maybe we can give it like 10 minutes now that we've sent remind prompts for guys to join in.
Okay, all right.
Yeah.
Thank you, Rakosa and Deborah, for joining. We are just giving people more time to join the meeting and then we'll start. Good afternoon, everyone. I think we can go ahead and start. So my name is, let me put on my camera there. So good afternoon, everyone. Thank you for joining us on a Saturday. My name is Mercy Wanjala. I'm a family physician from Kenya and the Deputy Executive Coordinator for AfroPHC. And it's a pleasure to have you all here with us today. So today, the agenda of this meeting is to have a consultation with the youth in Africa on an ongoing project that we have on a policy framework that is set to build the primary healthcare team for UHC in Africa. And before I go ahead to the agenda and among other things, I would like us all to introduce ourselves so that we can know who is in the room. I'll start going clockwise on my screen. I'll start with Jamie.
Okay, let me just start my video. Hi, everyone. My name is Jamie Colity. I am a medical doctor from South Africa and part of the AfroPHC Executive Coordinating Team. And thank you for everyone being here on a Saturday. And I'm happy to be part of this meeting. Thank you.
Thanks, Jamie. Almogira.
Hello, Dr. Al-Mughir Al-Amin, Jada Sida. I'm medical doctor by profession. I'm a consultant community medicine, or as we said, public health. My main line is health economics. Senior staff at National Response Fund in Sudan. It's my pride to be a part of the AfroPHC executive board.
Thank you so much for joining us today, Almogira. Marie-Claire.
Hi, good morning, everyone. My name is Marie-Claire Wangari. I am a general practitioner based in Kenya. I'm currently in project management, one of the people who took part in establishing the Youth Hub and formerly of the executive board of AfroPHC. Happy to be here.
Thank you so much for joining us, Marie-Claire. Irakoze. Okay, maybe he's having a problem unmuting. I'll move on to Christine.
Hi everyone, my name is Dr. Christine Kirubo. I'm also a general practitioner, though with a master's in international health, and I have an interest in health systems and generally primary healthcare. So that's why I decided to join. Happy to be here.
Thank you so much for joining us, Christine. Now that we know who is around the room, I will go ahead and project my screen so that we can see our agenda today. Is everyone able to see my screen?
Yes, we can see your screen.
Oh, great. So today I'm going to start first of all by giving us an introduction to what AfroPHC is and the chapter consultations that we are doing. Today we are doing a consultation for the one arm of the AfroPHC called the Youth Hub, and with young healthcare professionals and students from around Africa. So So we have started with welcome and introductions. Then after the introduction to AfroPHC, we are going to have a discussion around what challenge. We're going to have a discussion around the AfroPHC Youth Hub. Marie-Claire is going to give us a presentation on what the Youth Hub is and what the Youth Hub does. And then later we are going to review the policy framework, which is the draft policy framework that AfroPHC is developing around building the primary healthcare team for Africa. Then from there, we are going to have a discussion on how to take AfroPHC and also the AfroPHC Youth Hub forward. So just a brief history of AfroPHC and where AfroPHC started. The idea of AfroPHC was first born during a Wonka Africa conference in June 2019 in Kampala, where during a WHO Afro workshop with Prosper Tumusime, who was one of the people who was very instrumental in starting off AfroPHC, they had a discussion on There was a suggestion on forming the Africa Forum, like the European Forum for Primary Care that they have in Europe, which is doing a lot of work in terms of advancing primary healthcare in Europe. So the idea started there and the discussion started there, and the people who were there during the workshop later on met as well at the African August 2019 conference in Nairobi, which was an interprofessional practice and education network conference, where they talked to a number of people who are interested as well in forming the Africa Forum for Primary Healthcare, including Bongi Sibanda and Champion Nyoni, who are leaders within the African network. So after a few discussions, they decided to move it forward by doing a small meeting and workshop on UHC declaration during the UHC declaration in September 2019, where organizations such as Wonka Africa, ENAC, APN, ICN, TAF, AfriHealth, WHO, Afro, AMREF, and Prima Famed, amongst others, stood up to support the idea of starting an Africa Forum for Primary Healthcare and also being supporting organizations. This is what the initial pitch and proposal to start AfroPHC looked like. We as healthcare workers on the front lines of primary care services in health systems of Africa and supporters of the primary healthcare approach are committed to achieving universal health coverage in Africa. However, it is very easy for UHC to be seen as a financial solution without the required reform in primary care service delivery. The centrality of PHC to UHC effort may become lip service, especially when frontline primary care worker voices are ignored in Africa. So the first and most important point, and one of the most important values of AfroPHC, is that it is to do with the frontline primary care workers, and they are the voice of primary care because they're the ones who are on the ground. And we plan to bring together the leadership of all health workers at the coalface in primary care and ensure that we all have a voice in policy on primary care and primary healthcare in Africa. We hope to develop an Africa Forum for Primary Healthcare as the voice of primary care and primary healthcare team and its supporters, sharing and supporting each other in advocating for PHC. This statement actually later on went on to form the mission of AfroPHC and a lot of the values and activities that AfroPHC engages in order to promote primary healthcare in Africa. So there was an initial workshop in 2020 with introductions, and then a launch workshop was conducted on September 2020, which was the first joint exercise. And then from there was an AfroPHC for UHC workshop on 10th December 2020 with reflections on the AfroPHC statement, vision, mission, and the workforce issues that are facing primary healthcare in Africa. Later on, there was further discussion at the APN Symposium in November, which finally led to the AfroPHC AGM launch in 20th of April 2021, where structures such as the executive board was set up. So quite a number of members were involved and also voted for the then board that was made up of 9 people from all over Africa and also different disciplines. Later on, a few more members were co-opted to form the AfroPHC executive board. From there, AfroPHC moved on to engage other stakeholders, and currently we stand at 31 supporting organizations. We have an advisory board set up, which has meetings every 2 months, and engagements are ongoing with the WHO Civil Society Commission to improve engagements with civil society. And we also have the Youth Hub, where AfroPHC is reaching out to the youth, to students and young healthcare professionals who are interested in global health and also primary healthcare. One of the activities that we carry out here at AfroPHC is the policy workshops that we have every second Tuesday of the month. So far, we have done about almost 20 plus workshops. And we have 2 more remaining this year on the role of women in primary healthcare and also health equity in primary healthcare in Africa. And out of these policy workshops was born the document, which is the policy framework on building the primary healthcare team for UHC in Africa, that Jamie Colity will go through later. We also have training where we are focusing on building the capacity of the primary healthcare team in different ways, starting with management. We have the leadership, management, and governance for health system strengthening management course, which is in partnership with AMREF to train the frontline primary healthcare workers in management and governance principles. We started in 2021, where we had 798 people who registered, and 18 completed and graduated, and we've been having way more people graduating since then. In 2022, we have engaged 372 people, and we currently have monthly discussion groups on the third Tuesday of every month. Also, to build capacity in the clinical area, we have a CPD every week in partnership with Wonka Africa and the World Continuing Education Alliance, where we have 500 plus people joining the CPD webinars every Thursday. We also have are in the process of developing a curriculum framework for a 2-year online clinical postgraduate diploma in family medicine, for not just for general practitioners, but also for clinical officers and nursing officers who are interested in primary health care. We also have a research arm that aims to mentor young researchers and help them develop proposals and also publish their research. Enrollment started January this year and closed in 31st July with 19 researchers submitting concept notes for mentorship. We're in the process of matching the researchers with mentors who have volunteered. And the objectives are to develop an understanding of key documents affecting primary healthcare system, share relevant and published research on PHC systems in Africa, share and review research work in progress on PHC system in Africa, mentor PhD and master's researchers, and also network and develop collaborative research projects across the continent. So every first Tuesday of the month, we have a meeting where there's building of capacity for the young researchers and also just sharing of ideas. AfroPHC has also engaged in a collaboration across different organizations to form the Africa Population Cohort Consortium. We have received a grant to develop this consortium. When it comes to communication, we have recently hired a communications officer who's taking care of our communications, mostly via our website. If you go to afrophc.org, you'll find a lot more information on the things I've just spoken about. We have a monthly newsletter that everyone who is on our Google group and our mailing list receives. We also have so on social media, we have Facebook, Twitter, YouTube. You can go to those channels and get more information on the things that we have been doing since 2021. And we also have WhatsApp groups for regional chapters where we're trying to build a more local engagement with different regions in Africa. On the administration front, we have the executive coordination team that I will speak to later. That manages the day-to-day operations of AfroPHC. We have a strategic operational plan that we review every year that we follow in terms of our activities. We have a membership, I think right now, of about 1,600 or more people, and we are increasing membership almost on a daily basis. Then we are a registered NGO in South Africa. So as the executive coordination team is led by the executive coordinator, Prof. Shabir Musa, and I am the deputy executive coordinator, and I also coordinate the policy workshops and the management course. Then we have Jamie Colotty coordinating the clinical program and also mentorship. We have Ellie Bajo leading the CPD activities. We have the ARM, which is the AfroPHC research mentorship, being led by Senkire Kumi and assisted by Tijani Onseni. We have the Youth Hub, which was founded and led by Marie-Claire Wangari. She'll speak to it later. Then we have the communications officer, Innocent Ndambakua, who handles social media and communications. Then we have fundraising, which was recently started, which is handled by Rawia Mohammed. And all the people on the executive coordinating team are volunteers who have, under the mentorship of Prof. Shabir Musa, taken up different activities in AfroPHC and currently lead them. So coming to the main reason why we are here today, AfroPHC received a PHCPI microgrant to develop the policy framework on building the primary healthcare team for UHC in Africa by focusing on effectiveness. We were, I think, among, is it 5 or 6 of 200 applicants who received a grant for their proposal. And we've been conducting chapter consultations with different regions in Africa, which is ongoing. And today specifically, we are conducting consultations on the policy framework with the youth and youth leaders in Africa. So that is just what we are going to do today, which I had mentioned earlier. And with that, that's the end of my presentation. And I'd like to open the floor to anyone who has any questions. Or anyone who has joined who would like also to introduce themselves. Just feel free to raise your hand or unmute. We're a small group. Okay, I am assuming there are no questions. So I am going to move on to ask Marie-Claire to just talk a little bit about the Youth Hub, how it started, how it's going, and where we are. Marie-Claire, over to you.
Thank you, Mercy, for the wonderful introduction. I think one of the beautiful things about AfroPHC is that it's always continuously growing. And one of those measures of growth is the establishment of the Youth Hub. So the Youth Hub essentially came into inception around last year, where the executive board, as they began their mandate, wanted to actively engage youth and also youth organizations during the term. And hence, I was co-opted into the executive board as one of the young people. And then now one of the mandates was now to try and bring more youth organizations on board. Currently, the Youth Hub Steering Committee has give or take about 20 people from various organizations across the world, from all the health faculties. Excuse me, we have AfroPHC, which we recently signed a memorandum of understanding with at their recently concluded General Assembly, which represents medical students, International Federation of Medical Students Association. We have the International Pharmaceutical Students Federation, the Africa region, which we also have an MOU with, which was also passed in their August General Assembly, which represents pharmacy students in the region. We have the Federation of African Medical Student Associations also on board, as well as the Africa Leader Malaria's Alliance Youth Army, and we're also in talks with the nurses group, which is ANSI, and the dental group, which is IADS, and also now trying to formally establish our MOUs on the same, as well as the Rai Culture Group, which is a social innovation hub based in Kenya. So we have various youth on our hub from all parts of Africa, but the main reason we would really like to beef up this youth hub is because we realize that we have people who are even outside these bodies who want to engage in primary healthcare advocacy, who are primary healthcare practitioners, and we need to push the agenda of not just primary healthcare, having primary healthcare as a means of attaining UHC, but also using young people to bridge that gap. We did have this discussion on the sidelines of the Conference for Public Health in Africa last year as a side event, and I've posted the link on the chat. So in your free time, you're free to look at it. It's also on our AfroPHC YouTube page. And basically the general information of how we started and who's on the Youth Hub board is also available on our website, which is also on the chat text I have posted. But from my end, I think I'd like to welcome all of you to actively engage in our Youth Hub, if not just from giving inputs, but also assisting with management. A good number of the people in the ECT are Youth Hub members, or rather they are youth, they are young people. And AfroPHC always is looking for not just people to steer their organization, but people, how to empower them to be better leaders for tomorrow. Thank you.
Thank you so much, Marie-Claire, for that. Any questions about the Youth Hub or Youth Hub involvement? Ritanjali, we have Daniel, we have Karim, we have Christine. Any questions, comments, anything you'd like to know? Okay, so normally we have a little bit of discussion around challenges that you're facing in your regions on primary healthcare. So if you would like to make any comments around that, also I'm going to give you an opportunity to do that. And also if you've not introduced yourself, you could also take the opportunity to introduce yourself before you make the comment. Feel free to either raise your hand or just unmute and go ahead. Marie-Claire has also posted a link on the chat on the AfroPHC Youth Hub and also the event that the Youth Hub held last year during the first Public Health CDC conference, international conference. Almogira, go ahead.
Thank you very much. I would like first to say thank you for your nice presentation. You and Mari. Not only for that, but also I would like to appreciate your great efforts in developing this alliance or this organization, AfroPHC, for your great efforts, you and Mari also. I would like to inquire about the or I would like you to shed more light on the AfroPHC chapters. Because now this is on the West Africa, I would like to know what is the objectives behind that, and what is the hierarchy, or how is it administered, if possible. Marcy.
Thank you very much, Almogira, for that question. So as for the chapters, there's still something that is in inception. So the chapters are a way of AfroPHC increasing involvement and engagement on the ground from a regional level, because we find that a lot of our members want to engage more and would also like to engage in terms of policy, with policy around primary healthcare and other issues that affect healthcare workers in Africa, even with their own governments. So the step to build the chapters was to increase this involvement and engagement. And so far, we are still working on the structures of how the chapters will work, because they have not yet been formalized. But just so that people can start regional mobilization, we have the WhatsApp groups that you can join from our website, so that people can regionally begin to share ideas, share knowledge, share challenges, and see how they can take AfroPHC forward within the region. But once the structures are clear, we will share that and also go regionally building the different structures. That now we have the WhatsApp groups, which are facilitated by members of our executive board in the various regions. And as we do consultations, we are also asking for people to volunteer to act as interim regional task force leaders, so that we can help mobilize people in the various regions who are passionate about and work in the area of primary healthcare regionally. I hope that answers your question, Mogira.
Yes, thank you.
Okay, you're welcome. Ritanjali, is it Ritan? Oh,
yeah.
Did you want to say something?
Hello.
Hi.
Hello everyone. Yeah, I'm Dr. Ritanjali Sahu from India. I welcome you all and thank you all for giving me this chance, identifying and giving me to speak something. Actually, I'm very impressed, and though I have no idea, because though I have added in this group since last February, but not actively. But actively I joined when I became a speaker of the last session, that is July 5th, for that overview of research methods and setting the objectives and aims. So actually, I just wanted to know, because without any idea, I involve me in that research program as a speaker. And actually, I am very interested for various kind of research, and especially outside India. But being a private employee, we don't have so much of opportunity in India, for exploring all these things. But I'm so proud that I am being a member of this learn among your all learn personalities experts, and I am very much impressed, especially this policy framework, whatever you are doing, madam. Mercy madam, and that Mary madam. Really, it's very wonderful. Also in the West Africa group, WhatsApp group, I associated, and I had joined in the last meeting. It was very wonderful experience for me. But I don't have much bigger exposure in outside India. I just in the learning stage, I can say, though I am having 29 years of teaching and administrative experience in different nursing colleges in India. And but still, being a private employee, we don't have so much of exposure. I am just learning, and thankful to you all for recognizing me. Thank you, madam.
Thank you so
Thank you.
much for those kind words, and I'm glad that you are one of our speakers for our ARM, that's the research program. We really appreciate you and appreciate you joining AfroPHC and also following our activities. I will put my email on the chat. If you want to get involved more, you can always reach out to me, because we're always looking for people who are experienced to mentor our researchers and also mentor the young people within AfroPHC. So thank you so much. And thank you for being with us today. Christine?
Thank you.
Hello, sorry. Yes, just, I don't know, maybe a clarification because I'm not well versed with your core business, but maybe you can just clarify that for me. So are we looking at primary healthcare more so on the public, or is your organization looking at primary healthcare both in the public sector and also in the private sector, or in the private health system? Also, I mean, personally, the reason why I joined this is because I'm interested, and I'm actually in the process of setting up a clinic with a focus of primary health care privately. And also I wanted to, and I'm very impressed with what you said there, where you're talking about postgraduate diploma for non-doctors. So because that really helps in terms of ensuring the quality of the services that they offer. So has this started or not yet?
Thank you for those questions, Christine. So first of all, AfroPHC is a non-profit, and our main focus is on primary healthcare, on the area of policy and building capacity for the frontline healthcare workers. And that's where our activities have always centered around. So we do not focus on either private or public. Primary healthcare is primary healthcare, whether being provided by the public or the private. We have quite a number of our members who work in both. So it does not focus on government only. It's just a nonprofit that mobilizes and engages in advocacy for primary healthcare, building capacity in the area of primary healthcare, and also policy and directing policy towards primary healthcare and strengthening primary healthcare systems. I hope that answers your first question. On your next question, with the clinical postgraduate program on family medicine, we are in the process of developing the curriculum. It has not yet started, so we are still in the process of putting together the resources and also what the curriculum would look like. and the topics that will be included in the curriculum, but we have not yet started the program.
Great, thank you. That answers my question. Just one more thing. I would be interested in joining one of the WhatsApp groups. I don't know which one is around Nairobi, because I'm based in Nairobi. So if it's possible, and if I don't know what are the requirements for one to join, but that's something I'll be interested in. Thank you.
All right, Christine. If you go to our website, you will find a place there for chapters. So right now we don't do per country, we do regionally. So you can join our East Africa chapter, and you can also sign up as a member of AfroPHC, as that now being a member is free of charge. And once you sign up, you'll also be getting our newsletter and any kind of information regarding our activities. Diltoka? Gideon? Go ahead.
Yes, can you hear me?
Yes.
Okay, good morning, good afternoon, good evening. Sorry I joined late and you were almost rounding up the presentation when I joined. So some of the questions I will be asking, you must have covered it. So I'm Kevin, I'm from Nigeria, and I have joined AfroPHC mainly for the purpose of, okay, I'm a health economist, and though not a practitioner, but I've have a course to do some data collection at the primary healthcare level. So I've seen so many challenges at that level, which has prompted me to join AfroPHC. And I'm glad for your insight in trying to come up with the AfroPHC Youth Hub. I think that's a very good initiative. And I'm just hearing it today for the first time, so I hope to key into whatever program you will have. And then I think you asked a question about the challenges that have been faced at the PhD level in the different countries. So I would just like to share one or two for my own end. So first of all, here in Nigeria and where I reside currently, the primary healthcare level, just as in other countries, has a lot of challenges. And one of it is that government at national, state, and local level seems to be doing things in order to handle some of the challenges. And but you discover that some of these challenges still exist. And one of it is the health workers at the health workers at the health facility level. That's at the primary healthcare level. Just last week, there was a documentary at one of the health centers at southwestern Nigeria, and you have some of the nurses there complaining about the number of health workers at their facility. And in fact, they have people that have served in their health facility for about 10 years, but they are still not incorporated into the health system. They are just serving as volunteers for the past 10 years, not receiving any salary and nothing. So those are some of the challenges they face here. And then secondly, you have issues where government will tell you in publications, in news, they will tell you they have done certain things at the primary healthcare level. But when you go down really at that level, you discover that those challenges that they claim that they have tackled, those challenges still persist. So I think a lot of advocacy is needed in order to make sure that government is being held accountable to what it said it has done. Because when they say they do something, when you get there, you discover that nothing is being done. So advocacy is needed in order for government to take up some of the responsibility that they need to take up. So basically, those are some of the things I wanted to share. Once again, thank you very much. And I'm glad that I'm part of this youth work. Thank you very much.
Thank you so much, Gideon. I'm glad that you mentioned the issue of unpaid community health volunteers, because that's a big issue facing primary healthcare across Africa. I think in our consultations, we found that is quite a common problem. And we are hoping that governments will address it, because we have also included it in our policy framework that Jamie will go through later. Anyone else?
Maybe I can just contribute. On matters challenges for primary healthcare, I work in a county in Kenya, in Murang'a. Some of the challenges that I see we have, especially there, is that there's a lack of structure. For example, we're talking about community healthcare workers. We have them, but again, they're not on payroll, and it's like somehow voluntary, not voluntary. So that's definitely a challenge, because then how do you get them to be accountable and all that? And the other thing I see is that we have a lack of coordination between the primary healthcare facilities and systems, and what is termed to be maybe higher levels of medical services. So, for example, I know like in the level 4s and 5, we operate in such a way that it's like we're in a vacuum of some sort. We are not well versed. We don't have a good understanding of the fact that that there's a need for primary healthcare system. We don't have any coordination. So, for example, even in the clinics, there are some challenges, for example, for following up these chronic care patients for diabetes and hypertension. Because you see, it's not enough just to see them in the clinic and give them medication. Some of the education and awareness they need would require maybe someone to go and follow them up at their places. And when you think of someone to who you can now connect this patient with, you realize that you don't have the structure and you don't have the systems in place. We don't have that connection. So, for example, for the clinics like outpatient clinics for MOPC, DOPC, they need to be connected with people on the community level who can now follow up the patients and just ensure that these patients are adhering to the advice that they've been given in the clinics and so on. I think that's what I can think of for right now.
Thank you so much, Christine, for that. I think you've mentioned something very important, the continuum, both the continuum and continuity of care at primary healthcare level is lacking in many systems. And that is a very important component of primary healthcare, the continuity, the continuum of care, and also comprehensiveness, and not forgetting the community health volunteers and the fact that since they're working, they should be paid, and being paid would keep them accountable. So thank you for that. Anyone else want to go? Okay, if there is nobody else, maybe we'll still have room for more comments at the end. I would like to invite my colleague Jamie Quality to make a presentation on a summary of the policy framework. If you go to our website, you will find the full document there, and you can make comments on the document as you read it as well. So welcome, Jamie, over to you.
Great, thank you, Mercy. Let me just share my screen quickly. Okay, and let me just go to slideshow. Okay, perfect. Can everyone see my screen, and can you hear me fine?
Yes, we can.
Yes, loud and clear.
Okay, perfect. Thank you. So hi, everyone. As Mercy has said, I'm Jamie Quality, and as I said earlier in the introductions, I'm part of the AfroPHC Executive Coordinating Team. And today I'd just like to give a presentation on the AfroPHC's Call to Africa with some key points from our draft policy framework, so that we can just highlight those things before we have a discussion on the actual document. So here on our first page, we have our call to Africa, which is to join AfroPHC and build effective primary healthcare teams for universal health coverage in Africa. And just an overview of the presentation. So we want to heed the call of African health professionals and recognize African challenges and opportunities, as well as note global primary healthcare milestones. And the key elements of the call are to train, recruit, and maintain a sufficient frontline PHC workforce, as well as support PHC with resources and build robust PHC systems. So that's what we'll be talking about, is our PHC workforce, resources, and systems. So starting off with PHC workforce, we want to strengthen human resources for PHC, for which we call on Africa to build a larger, better trained PHC workforce with more opportunities, educational, financial, and clinical, and greater resources in order to enable PHC and UHC. We also want to build the team with task sharing and supportive supervision, for which we call on Africa to acknowledge the burden on all cadres in PHC and embrace interdisciplinary teamwork with a mix of all health professionals using respectful task sharing and supportive supervision for achieving PHC and UHC in Africa. Furthermore, under PHC workforce, we want to build distributed leadership, for which we call on Africa to embrace distributed leadership practices and education for it amongst all PHC workers and managers in order to achieve PHC and UHC in Africa. As well as to build clinical governance, we call on Africa to embrace the important role of postgraduate trained family doctors in decentralized primary care settings to support clinical governance, coordinated care, and efficient referrals to achieve PHC and UHC in Africa. Furthermore, under PHC workforce, we want to professionalize community health workers, for which we call on Africa to standardize, professionalize, and decently remunerate community healthcare workers that are strongly integrated with the PHC team, and furthermore, to aspire to a target of 1 community health worker per 1,000 persons by the year 2040 to achieve PHC and UHC in Africa. As well as to manage human resources better, we call on Africa to clarify and harmonize PHC workforce nomenclature for the different categories and disciplines in PHC, and to then embark on labor market analyses in PHC, in both public and private, and specific PHC human resourceful health policies and strategic plans to scale up the PHC health workforce by the year 2025 to achieve PHC and UHC in Africa. And furthermore, under PHC workforce, we want to develop human resources better, for which we call on Africa to implement a robust educational and credentialing infrastructure for developing a competent workforce that is dedicated to delivering comprehensive primary healthcare services necessary to achieve universal health coverage in Africa. Moving on to primary healthcare resources, we want to view political and funding action for primary healthcare as an investment, for which we call on Africa to regard health as an investment and to leverage political goodwill for action on primary healthcare or universal health coverage by defining PHC in budget terms, ring-fencing the financing of PHC, and committing to at least 2% of their GDP on primary healthcare for universal health coverage in Africa. As well as fight for global solidarity action on primary healthcare funding pools. We call on the world to re-examine global social solidarity on primary healthcare and strengthen contributions to primary healthcare for universal health coverage in Africa as a priority, starting with high-income countries increasing donor aid to 2% of their health spend, and donor aid funds allocating 30% to an African Union funding pool for integrated primary healthcare and universal health coverage in Africa by the year 2030. Furthermore, under PHC resources, we want to manage pooled funds with strategic purchasing, for which we call on Africa to work towards better funded single pools for universal health coverage funding, prioritizing strategic purchasing for primary healthcare with standard and transparent contracting of both public and private providers in empowered decentralized units of primary healthcare for universal health coverage in Africa, as well as reform PHC payment with blended capitation. We call on Africa to embrace simple national contracting of primary healthcare teams with mixed or blended capitation models, including capitation, fee-for-service and performance payments to achieve holistic and responsive primary health care and universal health coverage in Africa. Moving on to primary healthcare systems, we want to embrace the biopsychosocial spiritual approach for primary healthcare, for which we call on Africa to embrace the discipline of family medicine with its biopsychosocial approach to achieve primary healthcare and universal health coverage in Africa that is personalized, comprehensive, continuous, and coordinated in line with global standards, as well as envision comprehensive person, family, and people-centered primary healthcare, for which we call on Africa to embrace primary care, defined by the World Health Organization as an essential level of care that needs to be responsive, person, family, and people-centered, and covers the full spectrum of care within the paradigm of One Health for primary healthcare and universal health coverage in Africa. Health in all policies for robust primary healthcare, we call on Africa to prioritize primary healthcare as the foundation for universal health coverage, making health in all policies an integrating and developmental public health approach to decentralized government, strengthening the role of primary healthcare facilities with flexible models of non-hierarchical interdisciplinary teams, and creating integrated care models of public health service delivery of primary health care and universal health coverage in Africa, and to build quality in primary health care. We call on Africa to embrace the culture of quality and patient safety with strong teamwork, and to measure and monitor performance to achieve quality primary health care and universal health coverage in Africa. We also want to build the district health system, for which we call on Africa to place their trust in their frontline primary healthcare workers with decentralization of resources and the locus of control to bottom-up units of care, together with robust management functions to deliver an agreed-upon results and operational accountability to implement primary healthcare and universal health coverage in Africa. And empanel defined populations to a defined team, we call on Africa to embrace the strategy of empanelment of a defined population and linking them to a defined, fully staffed and equipped primary healthcare team as a foundational step to achieving primary healthcare and universal health coverage in Africa. Furthermore, under primary healthcare systems, we want to develop community-orientated primary care for Africa, for which we call on Africa to embrace community-oriented primary care in community practices of 30,000 by the year 2025, and aspire to community practices of 10,000 for achieving primary healthcare and universal health coverage in Africa by the year 2040. And then, pertaining to the blueprint for rural and marginalized health, we call on Africa to embrace the blueprint for rural health and rural-proof all health policies to support rural and marginalized primary health care comprehensively, especially creating step-ladder entry requirements for educational institutions and rural or marginalized student immersion for the full primary healthcare team to achieve primary healthcare and universal health coverage in Africa. Lastly, under PHC systems, we want innovative e-health that is patient and user-friendly, for which we call on Africa to embrace the variety of e-health solutions for primary healthcare by ensuring that sustainable national e-health strategies are supported by accessible infrastructure, interoperability, and user-friendly designs that enable the PHC team and patients and populations to enhance quality and support new models of care in primary healthcare and universal health coverage in Africa. So in summary, we call on Africa to empower and build an effective primary healthcare team to achieve primary healthcare and universal health coverage in Africa. We, as the African Forum for Primary Healthcare, commit to educating and empowering our members to support this goal in any way that we can. Thank you very much for listening. I'll hand over to Mercy again.
Thank you so much, Jamie, for going through that. The actual document is about 18 to 20 pages long, and it has more detail on the concepts that Jamie has just presented on. So I'd like to ask everyone from what Jamie has presented, and if anyone here has gone through the document, what is it about the document or about the concepts that you like? and what is it that you don't like, or what is it that you would like to see more of on the policy framework. Just feel free to unmute and comment. And in case you had not introduced yourself before, also feel free to introduce yourself as you make your comment. Or maybe I should start by asking how many have come across this policy framework. We have it on our website, and we've also posted links to the document on our various social media pages, on Facebook, on LinkedIn, on Instagram, and on Twitter as well. Any comments or questions or suggestions?
Maybe I can comment, Dr. Christian here. I think what the framework is really good. What maybe we could add on is, especially on the part of health systems recognizing family doctors as being the center of, around PHC. What I've seen in my county especially, and I don't know, maybe this is replicated in other counties, is, for example, I want to do family medicine just because of that interest. But when we come back to the counties and to the health systems as it is right now, they struggle to use us because they're not quite sure where to place these family doctors, after doing their masters and all. So I think it will be good, maybe in the policy framework, if we could find a way to include sensitization or maybe awareness for the county health system, for the county health management teams, on how they can utilize their family doctors, because most of the time when they come, it's like they don't know where to put you. Their mindset is already focused on the 4 primary specializations, physician, obs-gyn, and things like that. So it will be good for us to be able to create a structure where it's clearly like how the role of the family doctor is well indicated and pointed out, so that the counties can start embracing people who are going for family medicine and seeing it as something that is not just lucrative in the private sector, but can also be used in the public sector. Because I think when I was applying for this, I think just someone commented and said, I think this is something that is it's better placed in the private system or the private healthcare system. So I think it will be good for us to be able to showcase how these family doctors can be used in the public health system, and also how they can be the leaders of primary healthcare in terms of ensuring that the services are given their quality, ensuring that prevention and promotion of healthcare healthcare is promoted, and also just the different things that primary healthcare systems advocate for. I don't know if you understand me.
Yes, Christina, I understand you more than you know. The number of times I have to explain to people what I do sometimes gets borderline ridiculous, because you have to keep on explaining and re-explaining and defining your discipline. It's almost like they have never heard of it, despite the fact that it's been around for almost 40-something years. But still, I do understand the dilemma, and I do agree it is important to create advocacy around what family physicians do, especially because a lot of times you will find them being the lead in a primary healthcare team. And a lot of primary healthcare teams also struggle because they lack that clinical governance and direction. So I do agree it's important to create advocacy around the specialty of family medicine, because like we said, we are even developing a program that covers a family medicine, not only from the physician's perspective, but also for nurses and clinical officers, because they also form an important part of the primary healthcare team. So I do agree it's important that we create that awareness and advocacy as well. Thank you for those comments. I'm seeing someone had commented something on the chat. Daniel says, hi all, I like the approach of grassroots engagement upwards, where community healthcare workers become more empowered. This will go a greater mile in achieving primary healthcare. Thank you so much for that, Daniel, because all across Africa, what we are recognizing and realizing is that we do not have enough healthcare workers to send into the community. So community healthcare workers and health volunteers have become an important part of the primary health workforce. And it's something that we need to encourage in terms of policy and ensuring that they're not just volunteering, they're recognized as workers and are compensated as such, so that we can improve both their function and their accountability. Thank you, Daniel. Anyone else? Innocent, go ahead.
Thank you, Mercy. My name is Innocent Somboi. I'm based in Tanzania. I'm a member of AfroPHC Executive Board. I'm a president of Tanzania Association of Clinical Officers and Clinical Assistants. I'm also representing the Global Association of Clinical Officers and Physician Associates to the AfroPHC team. Thank you again. The document is well organized and it is well presented, and to me, it is well understood. What I want to put more emphasis is that most of we members, we don't spare much time to read a lot about this document. It's very important. It's very important for all of us to pass through it and to read effectively and to get understood of it. Because there are things maybe are not easily to be covered completely or well understood through this short period of meeting. So I encourage members to take more time to pass through it. And another thing I want to add on this policy document, I think I want to ask, how about for those countries in Africa who will not maybe accept or want to introduce the issue of family medicine? How can we convince them? Because we do differ. The policy from one country differ from another one. There are some countries, they have already started implementing the program of family medicine, but there are some of them in Africa, they have not yet introduced, and they have no any idea of introducing that concept. And our main aim is to have the universal health coverage. How can we achieve this one to those countries which are not accepting this program, or they are not interested with this program? How can we do this? I think we have to include this in our policy document. Thank you, Mercy. Over.
Thank you so much, Innocent, for those comments. I do agree that in Africa, the awareness on family medicine as a discipline and what family medicine does, and also the structure of primary healthcare and what primary healthcare does is not widely known. And I think just starting, like we say, we are starting from the grassroots. As AfroPHC members, as people who are passionate about primary healthcare, we have a voice, and we need to use that voice to educate and to advocate wherever we are. And for us here at AfroPHC, our work will be to amplify those voices and ensure that everyone hears and knows about primary healthcare and also family medicine as a discipline. As to whether people will embrace it or not, there is where we have little to no control, because we can make recommendation. I mean, the Alma Ata has been here since 1978, but how many governments have actually implemented it? So sometimes beyond advocacy, education, and sometimes also going to the area of activism, you find that there's little we can do to make people embrace something, but to just raise awareness and advocate and hope that our recommendations and our voice will be heard. Almogira, you had your hand up.
Thank you, Messi.
Yes, thank you. Thank you very much, Mercy. Just I would like to activate the participant because this document really was found after series of workshops, meetings, consultation, virtual, in person also some meetings. So we can call it like a cream of creams. So, but overall, we need all the voices, all the opinions, all the comments from all participants in order to have this policy document having a strong consensus upon it. Thank you.
Thank you so much, Almogira, for those comments and that reminder, because truly this document comes from the voices and contribution of everyone who has been joining our workshops since last year. So thank you very much. Anyone else would like to make any comments, any suggestions, or has any questions? We have Monica who has joined us, and Museme, and also Sakina.
Hello, everyone. Can you hear me?
Yes, we can hear you loud and clear, Sakina. Go ahead.
Thank you very much for organizing this meeting. It's very important to discuss together the health sector in Africa. Thank you for all the comments. I would like to add about supporting and enhancing private sector, especially startup project led by youth in Africa in health sector. It's very important to create a bridge between health sector in public and in private, especially startup. It's very important because we can't achieve the goals without the contribution of startup in Africa. Thank you.
Thank you so much, Sakina. And maybe you can just give us a little introduction, what you do, where you're from.
I'm from Algeria. I'm a biologist and project leader in medicinal plants sector.
Thank you so much, Sakina, for joining us.
Thank you.
Feel free to join AfroPHC. We are a multidisciplinary and interprofessional association. So you're also free to join as a member of AfroPHC. Marie-Claire, go ahead.
Thanks, Mercy. I think for me also, with this very timely policy document from AfroPHC, it might also be prudent that as we also push for reforms in the primary healthcare space, be it with like remuneration for the community health volunteers, we also think of bigger picture of like, how does this particular policy tie into things like the new public health order, tie into other global commitments that are being made, be it the Astana Declaration that was renewed a couple of years back, be it the journey or the marathon towards UHC 2030. And especially now, given that Africa's population is pretty youthful amongst all other continents on the region, how do we as youth play that role in deploying this policy at an African level, but not only at an African level where we have majority of the youth, but the ripple effects it have also on global policies and global commitments. Thanks.
Thank you so much, Marie-Claire, for those comments. And I do agree with you, because at the end of the day, the youth are the ones who are going to take up this work after those who started it are gone and continue it. So it's very important to have youth involvement and engagement. And I'd say one of the ways is like for this engagement, especially this day was specifically for the youth, for students, for young leaders to just come together. So I think one good place to start is like when youth are engaged, they also engage back and also interact with documents and build capacity and knowledge, because it is hard to speak of a topic that you do not know or you do not understand. And the only way to do that and to be more involved is to understand. So for instance, with primary healthcare, how many understand primary healthcare? How many are making that effort? And also from like a provider side kind of view is how many organizations, how many institutions are actually teaching the youth on things like primary healthcare and advocacy and policy. So those are two very important things to look at as we go forward as well. Thank you so much, Marie-Claire. Christine?
Yes, also just another comment. I understand that the organization is mainly geared towards policy and building capacity. I don't know whether you would consider supporting people who or maybe organizations that are willing to implement this policy, because what I've noticed is that we have a lot of great policies. We're not short of policies that that actually look good on paper, but we need to go a step further and maybe create partnerships with people who are willing and interested in implementing these policies, be it in public or in private sector, so that we can also create a database for evidence, like saying, okay, so this is what we are advocating for, and this is what our policies are. And we have evidence like certain organizations have implemented this and it is working, and use that evidence again to create even more, to convince more people to come on board in terms of matters primary healthcare. Because otherwise it could be, as the policy is good, but how can you convince them that this thing works, you know? Because especially for things like the public health sector and the governments in Africa, they need to see that primary healthcare is investing in primary healthcare will eventually cost the health, will reduce the costs of the health system, because then primary healthcare will be focusing on ensuring that people are healthy and promoting health and all that. And this will reduce the number of people who now need to move from primary healthcare to specialized healthcare. So we need to also, maybe you can consider identifying or maybe supporting organizations that are willing to implement this particular policy framework, so that you're able to gather the evidence that can support what we are talking about right now.
Thank you so much, Christine, for those comments. So one, the policy document, if you get the time, please go and read it. We have one model called the Chiawelo Community Practice Model that we are basing a lot of the things on the policy framework on. It is a medical practice that was run in the public sector by Prof. Shabir Musa on community-oriented primary care and community-oriented primary care principles. And so a lot of the things that are already in the document have already been shown to work there. That's in South Africa. And we are in the process of engaging the people who are willing, because especially with the research arm, we are working with people who have signed up and who are volunteered to work on operational research on primary healthcare. So that is something we are already doing, but in the form of, as you've said, showing evidence in the form of operational research with the AfroPHC research arm. Then what else had you mentioned? I think those were the two things that you mentioned. How do we engage? How do we show evidence? And then the third thing as well, we are collecting case studies from all over Africa to also accompany this document on how people have set up primary healthcare teams and primary healthcare at different sites in Africa. So in case you have them, or you know people who are willing to submit such case studies, you can as well ask and share. I will share on the chat later a link to the case studies. And the case studies are also accompanied by a prize for the people who will send in the best case studies. So we are offering, there are going to be prizes for submitting the case studies, and we're also going to showcase the case studies during our October workshop, which is going to be a culmination of the discussions on this policy document in person in South Africa. We are going to have posters on those case studies to also accompany the policy framework. So thank you so much for those comments. And I encourage everyone on the chat, please go to our website, click on it, read about the case studies, and also submit your case studies. If anywhere that you have worked or are currently working, you have ever had a primary healthcare team, how did you organize yourselves? How are you doing the continuum of care and the referral from one level to the other? So please feel free to share your case studies as well. Innocent, you had your hand up. Innocent, then Christine.
Thank you, Mercy. I really appreciate your participation in AfroPHC, and I always value your contributions. I really appreciate the presence of Jamie and the Claire Wangari. I really appreciate your participation. Mercy, I just want to add two more things. Well, one of the key things we have to know, or we have to put much emphasis, is that why youth have in AfroPHC, why youth in primary health care. But my question is, for the country like Tanzania, where I'm based, I have experienced one thing. Currently, there is a problem of unemployment in other sectors apart from healthcare industry. In Tanzania, many clinic officers, many nurses, and many doctors are employed by the government. But other non-medical practitioners like accountants or human resource managers, sociologists, and the other cadres apart from those who are working in health industries are not employed. Just a few of them are employed by the government. And currently they have changed their decisions. You may meet someone who may have a bachelor degree in telecommunications, and he or she may not get the employment from the government, and he can decide to change the color from information technology to medicine, to clinical officers, or to nurses, if he or she have the qualifications which meet the standard to be admitted in the institutions which offers the diploma or certificate course in the named courses. So you can find the one who decide to change the profession from the IT to a nurse, he can decide, or she can decide to take that decision at the year of 40s or 42 years or even 43, 45 years. And he or she can take the diploma in nursing, let's say for 3 years. And he or she may completed that diploma at 46 or 45 years old and get employed by the government. So my question is, can we include this person in the youth app, or is not fit to be included in that group of people? And if it is not, how can we include these people in our policy document? Thank you very much, Mercy. Over.
Thank you so much, Innocent. Those are very interesting and also pertinent questions. So with the focus on the Youth Hub, we are mainly focusing on students. to student leaders, both current and former student leaders. And that is why, as you heard Marie-Claire mentioned, a lot of engagement with student-led organizations. And the third thing is young healthcare professionals, those who have just freshly graduated. The reason why we are focusing on this group and around this group is, one, the group dynamics are homogeneous. They're in the same place in life, probably transiting from student to a healthcare worker, or transiting from being a student into the professional space. And so their thinking, view, knowledge, and experience on a lot of things is the same, and around that is basically the same, and also needing a lot of one, understanding perspective from their points of view, and with a lot of the emerging challenges that they're having compared to people who are already in the workforce and have been in the workforce. So that is what engagement in the Youth Hub is around, and also the issue of mentoring them as they enter into the professional space is key, because not everything is covered in their school curriculum. Not everything will be covered once you start working. You don't have what I think in the nursing profession they call preceptors to come and usher you into the health workforce or mentor you into that. So we are also hoping that through the engagement of the Youth Hub, we'll be able to help fill that gap. And I do agree with you, it is important to also consider the people who we call support in healthcare, because they are crucial. You know, the accountants, the HR, PR, they're also crucial to the workforce. And for that, I think what we can include in the policy framework is something around what do we do for onboarding, or what we call induction for primary healthcare teams. And these teams have to include people who also support the work that we do in healthcare. So I do agree that is a very pertinent thing that we need to consider as we develop the policy framework. Thank you, Innocent.
Thank you, Messi.
Anybody else want to have a comment? Okay, so we are coming to the close of our meeting, and I want to thank everyone who has joined. I have put in the chat a link to the policy framework. You can join there and also add your comments, and they will be reviewed as we are finalizing the write-up of the draft. So please just click the link and fill it in. Then you can go to our website and check out the different activities on research, on policy, and sign up for any one of them, and see how you can get involved and engage with the various projects that are ongoing in AfroPHC. As we bring this to a close also, just a reminder of the AfroPHC Youth Hub. Reach out if you would like to join the Youth Hub. I am going to put my email in the chat, because we have two types of membership. We have membership by students or former student leaders, and that is individual membership, and also organizational membership, where if your student-led organization would like to join AfroPHC, you can also reach out, and we can start the process of formalizing how we can work together with your organization. I'd take a last round of comments from Marie-Claire, then Jamie.
Yes, I think my end, I like how the discussions have gone on. For mine, it's after this youth deliberation, it is mainly two things that I think pop up for me. The first one is that youth are especially critical in next steps in healthcare, especially in the African continent, because one, African continent has the most youthful demographic, and in give or take about 10, 20 years from now, we'll be having close to 60% of the world's youth population on the continent. And two, despite this huge number of youth and the huge number of population on our continent, we still have a huge gap on bridging the health worker to patient ratio, and primary healthcare is a good means towards getting the health that we need and getting to universal health coverage. So how can we merge both these huge demographics that are wanting of huge population of youth and a gap in primary healthcare to get more healthcare workers, more community volunteers, or rather now more community health workers to help bridge the gap in healthcare that we have in our systems and manage some of the challenges that we have. And it is my hope that with this particular policy that we've discussed, we will find ways of implementing it at the basic grassroots level, and that the youth who are here or the youth that you know may be part of this process and may be aware of the policy we've discussed and its implications on health in the region. Thank you.
Jamie, and then we can have Francois, who is our Deputy President AfroPHC as well.
Great, thank you, Mercy. I just want to say thank you to everyone for being a part of our meeting today. I've been a part of a lot of our chapter discussions, and we've had some unique points raised today. So I think that just serves to emphasize the benefits of including the youth in these discussions on the chapter documents. So thank you to everyone for being here and providing us with those additional insights. I think it's going to be really valuable when we are putting forward our documents and finalizing everything. So thank you, and thank you for having me, and thank you for listening to my presentation earlier as well.
Thank you.
Thank you, Jamie. Welcome, Francois. You have found us winding up, and probably you could say something as we wind up our discussions.
Thank you for the opportunity, and it's amazing to see how far you are all going with the youth. Marie-Claire, I want to sincerely thank you for bringing along the youth, not leaving them behind, knowing that we are leaving no one behind. As the AfroPHC is growing, you are taking along the youth, and we are really grateful with the efforts and the work you are doing with them. I also want to thank Mercy and Jamie for being there with you. I just have to join you all to say thank you and congratulations to the good job you are doing. Thank you very much, and see you next time. Bye.
Thank you so much, Francois. Thank you, everyone. I wish you a lovely weekend. Please go to our website and sign up and engage more with AfroPHC. I'll put the emails on the chat. And look out for the call again for the case studies. We have extended the deadline from 5th September to 30th September. So you still have room to hand in your case study for the chance to win a prize of up to $400. So thank you. Bye-bye, everyone.
Thank you very much. Bye-bye.